Hello friends, we have learned about the focal lesions of the spleen, and in the focal lesions of the spleen, we have dealt with in the focal solid splenic masses. We have already dealt with malignant and benign lesions of the spleen. Now in the others we have splenic infarct. So let us now learn some important points about splenic infarct. Okay, in splenic infarct, this splenic infarction is the most common cause of focal splenic lesions, and it will mimic a mass. So, the splenic infarct might mimic a mass on ultrasonography. So, if this is the spleen, and in the spleen, if you have seen presence of typical, that is, it is most commonly present peripherally. So if it is present peripherally, and if it is present has a wedge shaped, okay, it is definitely wedge shaped, right? Wedge shaped hypoechoic lesion is noted. So if this is the spleen, in the whole spleen, if you see presence of a wedge shaped hypoechoic lesion is seen. So this is hypoechoic. Wedge-shaped hypoechoic lesion is seen in the spleen. Then this should always give a hint of splenic infarct. Then always and always you should think about splenic infarct. Peripheral wedge-shaped hypoechoic lesion is noted, that is splenic infarct. Okay, this might be seen, and sometimes you may also see this splenic infarct has, it might also look as multinodular in appearance with mass like changes, multinodular appearance, or there might be mass like changes with irregular margins might be seen. It might be multinodular, or mass like changes with irregular margins might also be seen. So if this is the spleen, and this is the normal spleen which is seen. Okay, and so to this normal spleen, you might see that this splenic infarct might have a multinodular and mass-like appearance with irregular margins might be seen. Okay, so this is also a splenic infarct. Now, one important thing is that the splenic infarction, especially the echogenicity of splenic infarct, this echogenicity of splenic infarct is related to the age of the infarction. So, echogenicity of splenic infarction is related to age of the infarction. So, more the echogenicity, more is the age of infarction. That means so echogenicity of splenic infarct are mainly related to the age of the infarction. So what does that mean? That means that if it is early stages, that means in early stages the infarction is actually hypoechoic, whereas in late stages has the fibrosis develops in the spleen, over time it might become hyperechoic. So in infarction, in the early stages, it will be hypoechoic, whereas in later stages, when the fibrosis sets in, the splenic infarction might become hyperechoic. So if you see, this is the picture of splenic infarct, which is, you can see, hypoechoic, and it is a wedge-shaped splenic infarct is seen, and it is also located in the periphery. So this is infarct, splenic infarct. So if you see, this is also a picture showing the splenic infarct. See, in the middle there are some hyperechoic region. So these hyperechoic regions are actually the fibrosis which has started to form. These are hypoechoic regions which are typical. Okay, this is the CT image showing the splenic infarct. So this is about the splenic infarction. Thank you.